Hello and welcome to a breakdown of the healthcare sections within EHCP. We focus quite a bit on the rest of the sections like B, F, I, but we don't tend to look too much at the health and social care sections. And quite often a lot of people don't fully understand or fully know what would be expected to go in them sections, so I thought it'd be handy if we actually did a breakdown of that. So the health needs section. So section C is the section for the healthcare needs. This is to set out the healthcare needs that relate to the child or young person's special educational needs. Some health needs would not be relating to SEN, would not ordinarily be included within the EHCP. So what we mean by that is things like routine dental where you go every year, eye test that you go every year. Them kinds of things would not be what we'd usually see in the health needs section. What we would normally see is, like, if they see a paediatrician, they've had a diagnosis of autism or EDS or ADHD or Down syndrome or a chromosome disorder or difficulty or difference, anything like that, that would usually be documented in the needs section of the EHCP. So it's things that are relating to the SEN, could be a reason why they have the SEN. They might need managing, so they might need medication or some sort of support within the school setting for the child to be able to attend. However, technically, they're not actually impacting their access to education per se. So yes, I get that they wouldn't necessarily be able to go to school if there was specific healthcare needs that weren't met. However, that's not necessarily classed as education. So health provision section. So any health needs that are documented within section C of an EHCP must then have provision to support them in section G. So every single need identified must have some sort of provision in section G to support that need. When we're looking at section D though, it's not like section F where it needs to be specified, quantified and all of that stuff. It's best practice to be able to be that way. However, the impact is different, and quite a lot of what we see in section D is attending appointments, managing medication, etc., which is specified and quantified where it can be. Outcomes relating to health. So if a child has needs and provision in the healthcare sections of an EHCP, so if we've got needs in C and provision in G, they must also have outcomes relating to these within section E. So any needs and provision must have an outcome at it. So you've got your needs, you've got your provision to support that, and then you've got your goal you're aiming for, what you're working for. I get that in quite a lot of health situations we're not necessarily going to be able to have anything major as an outcome, even if it's just attending appointments, learning how to manage illnesses or medications or treatments or something like that. Those are kinds of outcomes that we generally see in section E relating to health. When health needs is not health. So what I mean by this is there are times when needs that are health related impact the child within the school environment that the needs wouldn't be documented within section C but would instead be documented within section B. So any health needs that would impact their access to learning, that would make it difficult for them to access learning, things usually fall under speech and language therapy, occupational therapy, sometimes physio, them kinds of things that the child would need support in, or adult support in, or additional provision within school to access education, would then no longer be health needs per se. They would go in section B as education needs. And the same is when health provision is not health. If the provision that has been recommended is considered to educate or train a young person, then this would not be included in section G of the EHCP. It would be in section F. And what this means is that any provisions recommended that are going to educate the child or provide the staff or people around them with their required education, training to support the child's education, this would then be seen as educating or training, therefore would be in section F as legally deliverable and binding on the local authority and should be delivered within school. Whereas if it was in section G, it wouldn't necessarily be delivered in school. If not, some provisions they'd have to go to appointments, clinics, etc. for. Whereas in section F, it would all be delivered within the school environment or EOTIS package if that is what you've got. But it's really, really important to establish what it is that should be in G and what it is that should be in F, because that could be a massive difference between what gets delivered and what doesn't get delivered. So yeah, it's really important to make those differences and understanding them. So what I would say would be anything. So for example, if a child's going to school and they need a medication while in school, that's not going to educate or train the child. Therefore, we wouldn't expect that to be in section F, it'd be in G. However, if a child was going to school, for example, and needed, I'm trying to think, an AAC device, just in this example, and I'm just trying to find examples to give you. This is not a be-all and end-all kind of example either. So if a child has an AAC device, they would need that for communicating within the environment. And the staff around them, the staff around them would need the relevant training to be able to support the child and also know how to use that AAC device and keep it updated themselves. Therefore, that would be provision that we'd then see in section F, not G. So like I said, it's really, really important to make sure it is in the right section of health of the AHCP. And that's why sometimes, even if a child's got quite significant health needs, we might not see that represented in the section G or section C. It might be represented in B and F because it educates or trains the child or the people around them to be able to access education. And one of the things to also point out as well, if it's in B and F, it wouldn't be in C and G. You only have it in one part of the plan.